I'm Avery Haines, live on Hospital Row. Our CityNews investigation has revealed a disturbing tactic of harassing and even threatening death to parents who decide to circumcise their children. In fact, it is one of the most controversial and polarizing surgeries that is being done in Canadian hospitals. Many parents with sons struggling with just what to do. We took our story, as well as the debate over whether to circumcise or not, to the head of urology at Sick Kids Hospital.
In the modern days of the internet, it can be pretty painful with some of the information out there. The problem is when we look at information that accrues, it's based on worldwide information, and sometimes we try to transpose that to our own environment. And if we look at, for instance, Central Africa, where the level of education is different, the sexual preferences may be a lot different than what we have. There are very good data to show that circumcision reduces the risk of HIV. And if we look at many other sexually transmitted diseases, there's no doubt that it does remove that risk significantly by performing circumcision. Likewise, in the newborn, there's substantial data to show that doing neonatal circumcisions, not the older patient, sexually active patient, that by doing circumcision you'll reduce the risk of boyhood urinary tract infections. But to do so, you have to circumcise 110 boys to get the benefit for one patient. And is that something that's really a risk that we should take in Western culture?
You're saying that there's a lot of good medical information about the importance of circumcision in countries where there are issues with hygiene and with sexually transmitted diseases like HIV. In Canada, do you see the same sorts of benefits to circumcision, or is it almost neutral?
I would say there are no good data in Western civilizations to support circumcision for the same reasons that they might be done in Middle Africa.
And your bottom line is that in terms of North America, Canada, there is no medical reason to have a circumcision?
There are no good data, in my opinion, to support it as a routine procedure.